Hello, welcome. It is that time, Friday, 12 p.m. Eastern Time. Welcome to Ask Dr. Geier Live, wherever you're watching, whether that's YouTube, Facebook, Twitter, and wherever in the world, wherever in the country you are. I hope you're making today your masterpiece. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Yes, it is the time where I will answer your questions. Injuries, surgeries, recovery, rehab, whatever it is. Just know that I am not giving you medical advice. This is meant for general information and educational purposes only. This is intended for you to understand what your orthopedic surgeon or doctor told you. This is to help you better ask questions about treatments you might want to try or treatments they propose. This is not meant to tell you what to do in any way, shape, or form because I haven't seen you, examined you, looked at x-rays, looked at MRIs, so I am not giving you medical advice. I'm not your doctor, you're not my patient. If you want to come see me as a patient, I am happy to do that. There is information in the description below this video, and I'll talk a little bit about that more at the end of the video. Also, I would very, very much love it if you'd tell me your first name and where you are. I always love, Nazia, I hope I said that right, is from Qatar. Very cool. Or I know some people say Qatar. I don't actually know which is the right way to say it, but very, very cool to have you here. I'm a big Liverpool fan. I've been as long as I can remember, and there's rumors that a conglomerate, somebody in Qatar is interested in buying Liverpool. I don't know how true that is, but fairly interesting. But yeah, first name and where you're located, I would really appreciate it. All right, and as always too, I will stay as long as there are questions. Some days there's a lot, some days there aren't that many. Jagadish says hello. I hope I said that right. I apologize, but hello to you as well. All right. First, and I think the only question I have right now, Kunwar, how much time is required to heal from a femur segmental fracture? 22 years old, 6 months out from surgery for a femoral shaft fracture. So first of all, that's the key part, is the femur is the long bone in the thigh. And if it's broken in multiple levels, well, really, if that's broken in an adult just about anywhere, that's almost always going to be treated with surgery. And that surgery can either be a rod down the center of the bone, what's called an intramedullary rod or intramedullary nail, or it can be a plate and screws on the side of the bone. And there's pros and cons to each. It really depends on the specific nature of the fracture. I tend to like intramedullary nails because you can put weight on them right away, but potentially, given the nature of the fracture, maybe with a segmental one, it had to be plate and screws. I don't know. That would be a question for Kunwar. Having said that, typically that bone is slow to heal, even with the hardware in place. 3 to 4 months it often takes to heal, but it continues to get stronger after that. As far as getting the strength back and the ability to do what you did before, I've seen that take as long as a year after surgery. So it's a long process. There is absolutely no question. All right, Jagadish, again, I'm sure I'm getting that wrong. I had ACL surgery having problem with knee extension. I have thought, is that because of the wounds? I'm not really sure, again, because I can't examine you, what it is in your case. Typically, not getting all your knee extension back is actually a fairly common problem after ACL surgery. It can get bad enough that you can actually develop scar tissue in front of the graft, inside the knee, but in front of the ACL, which can block motion. That's called a cyclops lesion, and you have to go in with arthroscopic surgery to remove that soft tissue. It's like a ball of scar tissue that blocks motion. One of the tricks after ACL surgery is that you have to get full knee extension back almost immediately. In my experience, you have about 4 weeks to get it back, because once you don't get it at 4 weeks, no amount of physical therapy or braces or anything like that is going to get it. That doesn't seem like such a big deal, but if you don't have full extension, it's hard to walk normally without being able to get your knee all the way straight. So I have people immediately after surgery start working on that. And a lot of times the mistake people make is that they will sit on a couch or in their bed and put pillows under their knee thinking they're actually doing some good, but by keeping your knee bent, you make it that much harder to get it all the way straight. I also have people start physical therapy almost immediately after surgery, and one of the main things that they work on in physical therapy in those first few days, in the first week or two after surgery, is getting full knee range of motion. Once you get, again, about 4 to 6 weeks out from ACL surgery, if you don't have full extension, it's really difficult, short of another surgery, to go in and clean out scar tissue. It is really hard to get that back. All right. Kumar follows up, intramedullary nail screw dynamization 3 months after surgery. Excuse me, again, it's hard for me to say without looking at x-rays. Typically around 6 months is where you start calling it a delayed union, and that can progress to non-union. So it would just really be a matter of why that potentially is happening in you. Again, I can't see it, so it may be completely normal, but that's where you start worrying about, hey, do I need another surgery to exchange the hardware, or is there something else going on, for what that's worth. All right, Mary. Hand surgery, CMC joint replacement, mid-December, went well. What can she take or do to alleviate swelling and inflammation? So before I get into your question, because that is great, maybe other people are wondering what surgery you had. So the CMC joint is what some people call it the basal joint at the base of your thumb. Trying to show it. It's kind of right in this area between the the trapezium and the first metacarpal. Very common location for arthritis. Typically women more than men, but I've seen men get it. And it's actually a pretty big surgery. It involves a splint or a cast sometimes for 6 or 12 weeks, then a lot of rehab afterwards. As far as what can decrease swelling and inflammation, I don't know that there's anything I absolutely would tell people to do. I'm not a big fan of treatments like Advil or Aleve, ibuprofen or naproxen. I feel like those have more long-term harm than good for all sorts of reasons, and they can slow healing. That's been shown in animal studies, so I'm not real big on that. You know, short term, 2-3 times a day, maybe a short ice or cold pack. You know, maybe you start thinking of like a green tea supplement or curcumin. Those are fairly good anti-inflammatories, but without some of the downsides of the NSAIDs, the ibuprofens, and the naproxens. And then physical therapy to kind of work out the range of motion, and they can work out swelling too. But I don't know, that a lot of times it's something that just takes time after the injury. Yeah, so he had arthroscopic surgery, ACL reconstruction 28 days ago. So then that's about the phase where you want to have full extension. Maybe another couple of weeks, but you really want full extension. Completely being able to get it flat on a table or flat on the bed or flat on the couch without you being able to get your fingers under your knee by 4 to 6 weeks out from surgery. All right, Sergio says, come on, where'd it go? Well, there we are. I had surgery in the wrist, 2 months. Fluid is coming in your hand. I don't know. Without being involved, I'd go back to your doctor, your surgeon, and figure out what that is. Is it infection or just some serous draining? I can't really tell you. It's certainly not normal. So I would absolutely talk to your surgeon and just see what it is. Hopefully it's not a big deal, but I unfortunately can't tell you too much more than that without being involved and examining you and everything else and having done the surgery. Nazia, my sister badly fractured both feet, had surgery, needs to be back on her feet quickly as she is an athlete. How much time will it take to completely recover? Well, is she back on her foot without the support of crutches? How can she enhance? So as far as being back on her feet without crutches, it depends on where the fracture is. There's some bones that are not a big deal in the foot, and there's some that are very, very dangerous and notoriously slow to heal or prone not to heal. So that depends. If you can tell me the name of the bone, that can help a lot more. So that part of it I can't answer. The first part of how quick can you get back to recovery is getting it to heal and getting it to heal quickly. And then once you get to where that bone is healing, well on its way to healing, you can institute sort of a return to sports type of protocol where you go to walking, and then you go to jogging, and then you go to full practice, and then competitions. And that, at each step of the way, if you don't have any pain, you go a little bit further. But if you do, then you back off. And a physical therapist can be very helpful in that regards. But as far as being able to give a timeline, and again, I can't give advice, but I can't even give an answer, a general answer on that, because it really is dependent on where those fractures are. Did they need surgery? Did they not need surgery? There's a lot of variables there. I wish I could give you a more specific answer. Yeah, Kunwar, I can't, again, because it's not advice, don't send me x-rays. I can't read them anyway, because again, I'm not your doctor. That's a legal thing here in the United States. It's essentially practicing medicine, and I don't have a license wherever you are. So from Detroit, is that ACL surgery 2 weeks ago? When you say full knee extension, you just mean therapy on the therapy table? Yeah, just being able to get it all the way flat. I mean, literally equal to what you can get on your other knee. As flat as you can get your non-surgery knee, that's how you do it. And yes, you need to be able to do it. Not somebody pushing your knee down, even though that's how it usually starts. You need to be able to get it all the way straight, using your muscular strength to do it. And then ultimately you want to be able to, it goes that way flat where you're not having to use your muscles to do it. Let's see. Mary says she is in therapy. That is helpful. And you are welcome. Pull around my wound during knee extension, walking with it. Again, it's hard for me to know it's not that I'm trying to avoid your question. I can't examine you. I didn't do the surgery. So as far as wounds, that's not something that I have the ability to say, even if I wanted to. I just can't do that. And yes, Kunwar, I am an orthopedic surgeon. It's about practicing medicine. You cannot practice medicine by telehealth except with people that live in states where you have a license. And unless you're in North or South Carolina, I can't do that. So, and I don't do it at all on YouTube. So yes, I am an orthopedic surgeon. All right, Priscilla, 81 years old, diagnosed with DJD, degenerative joint disease. Can I continue to run on soft surfaces, short distances? So I am glad you asked this question. This is going to be my last question that I answer today. I think that's great because there's a whole lot of orthopedic surgeons that tell people with arthritis that they cannot run again, that they can't walk again, that that's going to cause more damage. There's actually very little evidence that that's the case. If anything, walking and running might actually be beneficial to the cartilage surfaces. Now, there's some caveats to that, and sometimes that can be painful, in which case maybe you modify it or vary up your exercise. But generally, I don't stop people from running. I don't stop people from long distance walking if they've got arthritis changes. I talk about treatments that hopefully can not only improve the symptoms, but hopefully get the muscles, tendons, ligaments around the knee or hip or wherever it is stronger, getting the cartilage hopefully to regrow a little bit, and stopping the continued damage. And that's a number of different treatments that I use to kind of get those to work together. So that's a good thing. And that actually brings up what I was going to say. If you want to see me as a patient, I am looking, and my practice is looking for 5 patients wherever you are that are willing to come to Charleston. If you have significant knee pain and want to get significantly better in the next 30 days, we have a treatment protocol we're really excited about. So there's a link in the description below this video. Click on that. It gets to my contact page. Fill all that out. And in the description, just type the word interested and I'll send you more details. Very, very excited. But yes, that's done in Charleston, South Carolina, not done by telehealth. A lot of the treatments that we do, you just can't do virtually. So for what that's worth. Really, really glad that you're here. Those of you with other questions, join us in a future Ask Dr. Geier episode and I will answer those. Thank you so much for joining. Again, if you want to come to Charleston, I would love, love, love to help and get you better, get you back to what you love to do. Have a wonderful weekend. I will see you very soon. Take care.